Summarizing continuous variables sampled in the course of clinical care. Riddles in Accountable Healthcare, published by Amazon, available in paperback or Kindle. Eran, Bellin, author. There are three study methods, analytic patterns. There's time to outcome, which compares the amount of elapsed time to outcome in two different groups. There's a list method. It generates spreadsheets with attribute values of interest, attributes of the cohort, attributes of events forced into a relationship with a cohort member, and last is time and range. Time and range summarize the amount of time spent in defined categories of continuous variable values. For example, how much time was spent in an INR range of 2 to 3, or an INR range of 0 to 2, or 3 to 5. We're going to give an example with erythropoietin and hematocrit. Erythropoietin is a drug that stimulates the production of red cells. When you have a patient who's anemic, let's say from kidney failure, you have a goal to bring the hematocrit, the concentration of red blood cells, up into a safe range to reduce the patient's symptoms. Because erythropoietin stimulates the production of red cells, you can titrate up or down the red cell production by the amount of erythropoietin you give. The ideal range is in 29 to 32. This is not the normal range. Normal patient has a hematocrit of 38, but it has been found that when you give a patient in renal failure or kidney failure a hematocrit greater than 32, mortality increases. If you drop below 29, symptoms worsen. So the sweet spot is between 29 to 32. We don't want to get people greater than 32 because of mortality. And also erythropoietin is expensive. So that we have here an unusual situation where cost and better medical care both go hand in hand. We want to reduce costs, we want to give better medical care, and it goes hand in hand. Let's take a look at a hematocrit as a cartoon across time. Here we have an individual patient across time over 365 days whose hematocrit is plotted on the y-axis and time on the x-axis. We've drawn a line at the 29 boundary, that is, we want the patients to be above 29, but we want them to be below 32. This is the target range. And as you can see, the first hematocrit is below the target range, the second is above it, the third is in the middle. How would you summarize this patient's hematocrit experience? Would you use the average? Clearly, that doesn't tell you very much. Would you use the last value? Well, the last value says the patient is in the right range. Or, and this is what we're recommending, use the percent of days in the target range. This being the most effective way to summarize the outcome. So first we have to determine what are the relevant hematocrit ranges. Well, we know greater than 32 is high and undesirable. We know that less than 29 is low and undesirable. And we know that a hematocrit of 29 to 32 is our target. So that's the first determination you make. How do you estimate the hematocrits between blood collections? These are blood tests that have been collected in the course of standard care. Ideally, you'd have a blood test every single day, and then you wouldn't have to estimate what the hematocrit was on any particular day. Problem, of course, is you can't draw blood from a patient every day. You will exsanguinate him. And since we're not vampires, it's not a good thing to do. So what we will do is we will estimate the hematocrit between draws by drawing a line, by interpolating. Now, some points are close enough that we believe the interpolation is a reasonable first-order approximation of the hematocrit. But some hematocrit draws are so far apart that it's really not reasonable to draw a straight line. In that case, what we do is we carry forward. We carry the last result forward for a period of time, and then we recognize the time between the end of the carry forward and the next draw as missing. Looking glass will give you the opportunity to control what the distance is that you are allowed to draw an interpolative line. And looking glass will also allow you to tell it how far to carry forward when the 2 points are too far apart. Now once you've done this, of drawing the interpolation line and the carry forward line, you now want to calculate the amount of time spent in each range. The low range is in blue, the target is in green, and the high is in red. What you do, basically, is just drop it perpendicular to the x-axis. So you can see that the patient spent this amount of time in the blue zone. He spent this amount of time in the target zone. And he spent this amount of time in the undesirable red zone, with the residual being missing. Now you are able to calculate for each patient the percentage of time spent in each of those zones and the actual number of days spent in each of those zones, and you can identify those patients whose hematocrits are too high and those that overall are too low. Let's build ourselves a cohort of patients who are in renal failure, kidney failure, and were started on erythropoietin. There's basically just two condition lines. The first line is the GFR, that's the measurement of glomerular filtration rate, how well the kidney is functioning, where you're going to find people who was less than 30 in 2005. And they also had erythropoietin prescribed in the outpatient within a year of this very low GFR. And we are going to follow these patients from their earliest erythropoietin. So we're going to have the index date start at the earliest erythropoietin prescription after the low GFR. So these are patients who have had kidney failure, started on erythropoietin, and the index date is pointing to the date time of the erythropoietin prescription. And when we use this to do our analyses, we'll be able to build intervals from the date time of the erythropoietin prescription. Just as in other methods, we have the racetrack paradigm, the start flag, which starts at the index, going forward in time to an end flag of 365 days, and we're going to measure hematocrits. So from everyone's index date, which is the moment of the erythropoietin prescription, we're going to follow them forward 365 days, and we're going to measure all their hematocrits. Now the time and range method needs you to tell it what are the ranges of the hematocrit. So there's a rule set, and you click on the triple button to open that up. And what you see is it asks you what is the interpolation interval, that is, how far can two crits be, and you'll still draw a line between them. In this case we said 180 days. At 181 days you can't draw a line, but 180 days or less you can draw a line between the two observations. And if you can't draw a line between the two observations because they're too far apart, you have the carry forward interval of 90 days. That is, to carry the last value forward 90 days. You also tell Looking Glass what are your categories, low, target, and high. Low is between 0 to 29, inclusive of 0. Target is 29 to 32, inclusive of 29. And high is from 32 to 65, inclusive of 32. In addition, you dichotomize into good or bad each of these categorics. So 0 to 29 is bad, 29 to 32 is good, 32 to 65 is bad. This is useful so when Looking Glass wants to summarize in simple relative risk or risk differences, it can basically dichotomize each of these categories that you've provided. You notice the unit of time is days. If you're in an ICU and you were managing people's sugars, you might make the unit of time hours. And then you run Looking Glass. And this is the output. We compared a cohort of patients in 2005 to a cohort of patients in 2010. In 2005, 13.5% of the time the patients were in range, in target range. 17% of the time they were in target range in 2010. So that's an improvement. Of interest is that in 2005, 54% of the patients were in the high zone, the dangerous zone, and 35% were in the dangerous zone in 2010. So we've clearly improved on keeping patients out of this dangerous zone. When we look at the percentage of good, it's 13% good in 2005 and about 17% good in 2010, with a relative risk of 1.31 and a confidence interval that excludes 1, so there's been a significant change. Similarly, risk difference, the difference excludes 0, so it's statistically significant. That's the CLG time and range method. Longitudinal perspective evaluates quality by counting time spent in the appropriate range of hematocrit values. You save money while protecting patients' health by focusing on the relevant longitudinal metric. For further insights, read Riddles in Accountable Healthcare, published by Amazon, available in paperback and Kindle, written by Eran Bellin.